Hi, I'm Dr. Olga Shvab. I'm aesthetic doctor and expert and trainer. Also, I'm influencer and a beauty blogger. So let's discuss today in this video together one important topic such as lip filler and side effects. Let's talk about this weird side effect, hyaluron mustaches. It looks really weird, and we see this quite often around with people who already were injected with lip filler. And you see this as the sausage here or mustaches above your red part of the lips. And sometimes it's also this specific vertical line where when you smile it's a vertical wrinkle which appears also from this unwanted amount of hyaluron above the lip. And sometimes we also call this effect like monkey face when it's too much product is migrate above the red part of the lip. It looks really awful and it's better not to inject your lips than to have this really strange looking face, and this makes you really afraid of fillers. What do you think? Is it addressing more to the product or to your injector skills and technique? Please let me know in the comments what do you think about it, or maybe this is a quantity of the product the main reason. Let's think. I think it's all important. Actually, all these reasons are make sense. So let's talk first about products, because really it's important to make a right choice for every single girl and woman. You probably already noticed that everyone has their own product which more suitable for the beautiful result. And sometimes people they tell, oh, I love this one, or I like this one because this doesn't migrate in my lips, all the others they are not so good, and also they love a certain technique. So let's think how product affect on our results.
Elise, if I give you any more collagen, your lips are going to look like they got stuck in a pool drain.
I have to look sexy.
We have a lot of products on the market now. We mostly use hyaluronic acid as a lip filler. And anyway, we have options, we have choice, we have big brands, small brands, and so on. And we have a lot of experience. Some of the product they have more tend to migration due to their viscosity, elasticity, and some product they have less tend to migration. So from the big brands, my favorite variants are Juvederm Volift from Allergan, also RHA free from Texan products, and I like the special formulas which were designed specifically for the lips. They already have special dynamic viscosity, and then you need just to look to the variant of the lips and then you choose accordingly. So it's like crystalline keys, one of my favorites. And by the way, we have now on the market the new formula Lip Lift. I actually love it so much because for me it's in the middle between Relax Deep. You know that it's good for lips and the result is very good and low risk of migration. And in between also Juvederm Volift. Sometimes Volift gives us more swollen lips, but it's temporary, of course. And this Hyal Lip Lift, it's somewhere in between these two products. So I prefer this one instead of Volift and instead of Relax Deep. But sometimes, you know, people they know better which one they love. They ask you about specifically this product or that product, and you can also can try this Hyal feel specific formula for the lips. And by the way, they have two formulas. Lip lift, this is 1 milliliter, and lip light, this is 0.5 milliliter. Sometimes it's necessary and important because some girls, they just want to try, they don't want the big lips, and sometimes it's more risky. When you get strong product and more quantity, then it's more risky for migration. And then to be on the safe side, you better use 0.5 milliliter of the certain product. That's why this product is quite interesting to try because they have these two variants with the volume. So also it's important for our results, professional skills and techniques. When you inject lip filler, it's important how you start. It's important your depth of your injection and actually the direction of your injection and even the size of the needle. I mostly prefer 30th gauge. This is the most thin needle which is suitable for certain products with this viscosity, I mean. And then you need to check every time you inject that if you inject something like Russian lips or Hollywood style lips and you go from above the lip, don't inject from the white part, you start from the red part. It's important. And then you go not so much deep, not in the muscle, not under the muscle. As deeper you are, then it's more risky for migration. And also it's risky to get complications, embolization and then necrosis. It's quite risky and also not nice to have it and very stressful. And you go just more superficially, like 1.5 to 2 millimeters depth, and you inject, you try to inject the same amount during you're going out from the tissues. As more gentle you inject, as better the shape. And then actually this product, what I told you about, it's very nice to get this perfect version of the upper lip. We call it lip flip. We can achieve it with Botox products and I mean with botulinum toxins. And we also can improve this result and also we can achieve this result, lip flip, the upper lip eversion with the certain products if you know how to inject them. It's the most important here, it's your technique. If you want to become more expertise, if you want to increase, to improve your skills with botulinum toxin treatment, with results, you are welcome to this online course. The first group we already started, but still you can join because videos will be available and you can watch them later. So we will have several lessons. Our participants already watched two first lessons about how to dilute Botox, botulinum toxins, what is the difference in between classical and stronger dilution, how we can treat different muscles and patterns. Also we talked about muscles, their function and dynamics. How we treat the face as a one unit, how we deal with every muscle, how deep we inject, how many units we inject, what is the direction of the needle. So we talk about logical anatomy and correct technique. It helps you a lot to work safe with great results. So then you also have to consider that you don't go deep, you inject more superficially, you inject slowly, you inject gently and without overcorrection, without injecting big amount of the product. And also let's talk about more risks for some people. For example, if you already were injected with lip filler and you had this problem before and then specialists they use Hyaluronic for you to get it out, to dissolve it. And then if people know about this, they told that previously they go to highlights one time or more, then you need to be more conscious with these clients. And if you are that one who already had it, you probably need to tell about this to your professional, not to get it again. So you have to be careful with technique. And I would start with the contour first, with not so strong products, something in the middle, more dynamic, for example, as Bilateral Intense or Mona Lisa Soft or Hyalfil X, for example, and then you inject just a contour and you wait a couple of months. If everything good, they talk, they smile, no migration, then you can add 0.5 more to the lip volume. You can use Hyalfil, for example, this lip light, 0.5 milliliter of the product, and then you will be on the safe side. There will be no migration, everything will be good. Another cases with people who has more risks, for example, when you have these masculine lips, very strong lips, and small amount of fat in this area, fat tissues in this area. So this muscle, orbicularis oris muscle, is very dynamic, and when you talk, when you kiss, product could move, and as stronger your muscle, as more risky for migration again. And how to analyze it? You just, when you do assessment, or you look to the mirror and you see that you have more masculine appearance, like smaller, thinner lips and stronger tissues, then probably you are that one who has these masculine lips, and for you it's better to stick to the contour first and go the same way. First contour, then wait, and then you can add a less amount to the volume, to the shape of the lips, and then you will be again beautiful and safe in terms of migration. So let's summarize. For us, it's important to get a certain product, pay attention to special products which were designed specifically for the lips, lips formulas such as Restylane Kiss or Hyalfil, this lip lift and lip light, also specifically for lips. And then you choose the product, you think about the quantity. Do you need 1 ml or you start with 0.5 milliliter? Again, Hyalfil, they have 0.5 milliliter formula lip light, and you can safely use it. And then we need to think about our technique. We need to be very gentle while injecting. We don't go deep intramuscularly or under the muscle. We stay superficially, 1.5 millimeters depth, and our needle should be 30 gauge. And we go retrogradely and inject. Sometimes we inject boluses, vectors, we inject different styles such as Russian lips or Hollywood style or just a contour, but always we need to be gentle without overcorrecting, without pushing on the product, and then we will be more safe. And I wish you great results. If you have questions, or you already had some cases in your practicing, or you are that one who got this problem, please let us know in the comments, because here we are one great community and we need to talk about such things to avoid them in future, and to help people who has this problem and it's really difficult to figure out what is the problem and how to solve it. I wish you all the best and see you in the next video. Bye bye!